You know, I was in a conversation the other day, and we were talking about general happiness of an individual. And, you know, and this was an individual with a lot of money, but I made mention of something. And that is that, you know, I don't care how much money you got, or how famous you are, or how psychologically adept one may think he or she is. Health is important. You know, and what plays a major role in the psychological, if you please, well-being of an individual is health, and is being healthy, and having access to health care, and being diagnosed for things when you think you got a problem. So today I'm more than a little pleased to be able to interview Ms. Catherine. Is it Dr. McLeod?
Nope.
It's Mrs. Catherine
Yep.
McLeod, although that's not her husband's name, but we're going to go with that anyway.
Yep.
Ms. Catherine McLeod, who's the Executive Director of First Choice Primary Care Facility. And it's kind of interesting because I've kind of known a little bit about it, but in just trying to, you know, one of the primary focuses of a call to action is to try to impart information about a lot of different disciplines and subjects, but we're very, very concerned about the health and well-being of the community. Consequently, we have with us today Mrs. Catherine McLeod from First Choice Primary Care. This is a call to action.
A call to action.
And like I said, welcome.
Well, thank you.
Mrs.
I'm pleased
McLeod,
to be here.
Catherine McLeod, to a call to action. Tell us a little bit first about yourself.
Well, thank you. I moved to Macon 20 years ago when my husband took a job as the city attorney. And I grew up in North Carolina. We lived in Washington, D.C., but he was originally from Albany, Georgia.
Okay.
So we had 3 little kids and bailed out of Washington, D.C. We wanted to raise our kids in a place not quite so hectic. Ironically, my daughter has moved right back to Washington,
wow.
D.C. But so I have 3 children in their 20s, and my husband, Pope Langstaff, is a lawyer here.
I remember Pope.
Yep. I have a master's in public health and health policy, and have for 11 years now been working with First Choice Primary Care.
Yeah, outstanding. Well, let's talk a little bit, first of all, about the general mission of First Choice Primary Care.
Well, our mission is to improve the health of the medically underserved in our community. When we say underserved, we don't just mean uninsured. There are a lot of people who may have insurance, but if you can't get in to see a doctor when you need to be seen, or somebody doesn't accept your insurance, or you can't afford the copays and the out-of-pocket costs, you don't really have access to what you need.
That's
and
correct.
So you can be underserved even though you have insurance. So that's a pretty broad mission. And we have offices in both Macon-Bibb and Houston counties. We're a private nonprofit organization with a local board of directors. So we're independent, but we were formed by those local volunteers, community people who saw the need for increased access to primary care years ago.
Now that's such a worded, specific mission that you have. Now, that does, irrespective of the class or kind of medical care that one might would need, including diagnosis and prevention, does your organization also deal with that?
Yes, we do a great deal of that. We now have 6 offices, 6 locations. We have 5 physicians who work full-time as employed physicians for us. They're not volunteers, they're paid. That's their full-time job. 7 nurse practitioners who do the same. Then we also have a few other nurse practitioners who work 1 day a week with us that they teach in nursing programs and keep up their clinical skills by working with us. So on any given day, those doctors and nurse practitioners, along with our other staff, are diagnosing and treating diabetes, high blood pressure, all kinds of chronic conditions, as well as more acute.
Asthma.
Yes, a good bit of asthma
Yeah.
and chronic obstructive pulmonary disease, all kinds of heart and
Well, now, let's assume that somebody viewing this show or listening to this show would fit one of those categories, because you said uninsured, or underinsured, or insured,
Right.
because you don't draw a line between those things. So what you're saying is that if in fact a person has a health concern, if there is a circumstance that would affect that person's ability to be seen or to get health care, then First Choice would be able to provide that care.
we can see anyone. You can live outside of Macon Bibb. It doesn't. We don't ask where you live. Well, we do ask, but it doesn't. We'll
Right,
see anybody.
right.
We like to know where our patients are coming
Right,
from when we're looking. What to try and learn more about the needs of the
Right.
community. But right now, about a third of our patients have no insurance.
Wow.
And they pay on a sliding fee scale that is based on their family income. We get a federal grant that allows us to do this. So we're not a free clinic. Now, there are some people in certain circumstances, like if someone is homeless or has just been evicted from their apartment, we know there's a real immediate need and a special circumstance, we would waive the copays. But in general, people have some responsibility, but we
Absolutely.
work with people on payment plans and to make that manageable. But so about a third of our patients with no insurance. The remainder are divided almost equally between Medicare, Medicaid, and commercial insurance like Blue Cross or Humana. A lot of our patients move back and forth between those groups. They might not have insurance and then they get benefits or they lose it. What we want to offer to people is a medical home. If you like the doctor or nurse practitioner you're seeing, you don't have to change just because your insurance
Wow.
status changes.
Wow.
You get to know us, our staff, and you're not always having to start over
Right.
somebody new.
Right. Now, what areas specifically of health services do you provide? I mean, is it limited to any one kind of health problem, or are you positioned, if you please, to treat whatever you're faced with?
Well, we don't always treat it directly because we like any other family physician, would refer to a specialist or send somebody somewhere for diagnostic imaging if they needed a CAT scan or MRI. We don't do that ourselves.
Right.
But we do lab. If you came into the office, we would draw we do the lab work for regular, checking your cholesterol or your hemoglobin A1C or all those things. We would do that. We do a lot of women care. A lot of women that come to us,
Right.
we'll do their Pap smear. We help them, send them for a mammogram. We don't.
We
do that
just talked
ourselves.
about mammograms
With Dr. Dale.
with Dr. Dale and the importance of it.
Well, we have in the past had some funding from the local Susan G. Komen Foundation. We could use that grant money to pay for mammograms for uninsured women. And we worked with the breast center here at Navicent that funding went away, but now United Way is working on raising some funding.
Right.
So we help negotiate lower prices, and it comes through, we order it and we pay for it when we have those grant funds. So it's a lot more accessible to.
Well, that's how, I'm seriously concerned about disparity in healthcare. Traditionally, people with fewer resources, don't get the same kind of care. But much of that can be attributable to the lack of education, because what I'm hearing you say is that, irrespective of the category, then there is a resource through your organization available. I just want people to know that if in fact that you've got a health problem, then it's addressable, through First Choice Primary or some other resource in the community in an effort to, to make this a healthier community. But in order to be a healthier community, then we would need to be a more informed community. So that is very extremely important. Well, what about other than just MD? I mean, what about prescriptions and pharmacy and dentists and other forms of problems?
Well, I'll talk about pharmacy first.
Okay.
We have in our Macon office, our main office downtown on Walnut Street, we have a pharmacy right, you walk in the front door and it is right there.
Right.
We also have contracts with some other local pharmacies because we can purchase drugs cheaper through, as a community health center, this federal program we participate in, we have access to cheaper drugs. So we have a contract with individual pharmacies where we buy the drugs and they dispense them.
Okay.
That means, and it only applies to prescriptions we write for our patients. So there's some real limitations, but it does allow us to help our patients, particularly those with chronic conditions. Insulin is a great example. Inhalers for somebody with asthma or COPD, those are quite expensive. Sometimes we can help patients get free medications through the drug companies, the prescription assistance programs. And we can help them get these cheaper prescriptions until that comes through. And so we work with community pharmacies as well as that pharmacy that's in our office.
That is so important. And there again, I've seen instances and situations wherein people don't, they just kind of let themselves go, because they don't have the resources for prescriptions or doctors or things of that nature.
Well,
and it's sad. It breaks my heart.
Well, I think our clinical staffs, they spend a lot of time trying to find medications that work and that are affordable, and then trying to get people to keep taking them if they're working. And it's a challenge. I know people are juggling financially, but education is a big piece of it.
Right. Because I've seen too many instances where people don't take their medication, and then sometimes it's because of economic reasons, and it results in something very, very negative happening to them. Well, what about other forms of?
You mentioned a psychologist. We don't have a psychologist on staff. We do have a part-time licensed clinical social worker who can provide behavioral health. And we're trying to expand that. We're trying to hire a full-time licensed clinical social worker. We've always worked closely with River Edge in a partnership. And currently the part-time social worker we have it's a River Edge employee who works. We kind of buy some of that time, but we need more. So so we're working with River Edge to try and figure out the best way to complement what they do. We know whether it's the health department or the volunteer clinic or River Edge or the hospitals, there are a lot of resources in Macon, but there's a huge need. So we want to figure out how we collaborate.
Right.
And we're not competing with anybody.
Absolutely.
We want to figure out who's in the best position to
Right.
tackle a need.
Right. Well, what about prescription, optical needs?
We don't currently have, we can do an eye exam just for vision purposes, and somebody who's diabetic and needs a retinal exam, we have little things that'll take a picture of your retina and send it off to an ophthalmologist to make sure there's no problem related to the diabetes. But we don't have a regular way to provide eyeglasses. We periodically have either Prevent Blindness Georgia or some other organization come in and do vision clinics, but that's not on a regular basis.
If one needs an ophthalmologist, do you have ophthalmologists who are working with you, or would they need to try to find another avenue of dealing with that?
Well, we would refer somebody to a community ophthalmologist. We don't currently have any special programs.
Okay.
I would love to do, one of our offices is a school-based health center. It sits on the grounds of Ingram Pie Elementary. So we see the children in the school, but we can also see people that live in the neighborhood.
Right.
We were, Dr. Howard, the principal at Ingram Pie, and Dr. Jones have been very supportive.
So right there at the school.
It's a separate building. We got a grant.
But it's on the campus.
It is. If you are looking at Ingram Pie, it's just another little building. Across the street is Felton Homes and the Buck Melton Center. So we have a full-time nurse practitioner who is there, and a couple of days a week there's a second nurse practitioner.
Wow.
We know children sometimes need, particularly as they're approaching puberty, their eyesight starts changing. So we'd love to be able to do more. That's one of the things on my wish list to be able to help more with vision.
Right. This is a call to action.
Call to action.
I'm your host, Alex Haversham. I'm having this very, very interesting medicinal conversation with Miss Catherine McLeod, who's the executive director of First Choice Primary Care. And, I kind of broke in where she was talking about a location at Ingram Pie. Let's talk some about the other locations.
Okay.
And then let's begin. Tell me the relationship between, the facility in South Macon. I think that isn't that a special, and to be honest with you, you don't even remember this. But years ago, there was a doctor there named Dr. Eberhard. Many years ago. So I know that location has for years been a hub, for individuals needing health care, medical care, what have you. But just tell that story because I think it's very interesting.
Well, it is, and that has been, it's called South Macon Family Physicians. It's on Houston Avenue, down near Bruce Elementary. And Dr. Eberhardt was before my time in Macon.
Had you heard of him?
Yes, because Dr. Bill Brooks, who has been practicing there for 40 years, I believe.
Yeah.
He actually approached us a few years ago. He and Dr. Tim Graves, who's our medical director, have known each other for many years. both family medicine physicians with a long history in Macon. So Dr. Brooks was not ready to retire, but he needed to make the transition to electronic medical records and do some things to kind of upgrade his practice. That's kind of an overwhelming task when you're a solo practitioner.
Yes.
You're right that is a real hub. That is the only source of primary care in that area of Macon.
Yes.
And the medical center, Navicent, knew that as well. They had an interest in keeping that office open. So they gave us a community benefit grant that allowed us to go in and buy the computers and the software.
Wow.
So now Dr. Brooks works with First Choice. He is one of those 5 physicians. We also have a nurse practitioner working in the office with him. We're getting ready to do some renovations and build out some additional clinical space there.
Right.
If we can recruit another physician, we'd love to put another doctor there.
Right.
Because there are more people than we can see.
I love and appreciate what you all are doing. Well, let's talk some about the other locations.
Okay.
And other interesting factors that you think will contribute to our knowledge about First Choice.
Well, thank you. Each one of our sites is really different and have their own character in a way, even though they all provide the same basic services. Our main office is on Walnut Street, down near State Bank, and we have rented 2 buildings from Mulberry Methodist Church from the beginning. So the old Sheftall's Barbershop is one of those buildings. That's a landmark for some folks who've been here a while. But we have connected those 2 buildings, and we have 3 physicians and some nurse practitioners there, and the pharmacy. We operate the clinic at Daybreak 1 day a week. There's a nurse practitioner who sees patients at Daybreak, the homeless day
Now,
shelter.
Daybreak is the homeless hub.
Correct.
Yeah.
So that clinic is part of our operation. That means they have access to those cheaper prescriptions. Our malpractice insurance covers them. It was a way to support the services at Daybreak. And we have an office that is inside the Bibb County Health Department. We rent some space from the health department. One of the reasons we're there is, River Edge is just down the hall. A lot of people that are coming to River Edge for treatment have difficulty navigating their way to a doctor's appointment. So they can just come down the hall to us. But it's not just, it's for anyone. So we have full-time clinical staff there as well.
Wow.
And then we have an office. In 2014, we opened up an office in Warner Robins. We're on Green Street, just off of North Davis Drive. The city of Warner Robins and the hospital asked us to come try and support that area of Warner Robins. So that's
kind of
it is. It's almost immediately across the street.
Right. I'm familiar with that
and
facility.
We work a good bit with them since we feel like we're accessible. We got to cross the street, but still
let me
walking
interject something. I just think it's very, very important that I think it's kind of like a community responsibility to the extent possible that there are avenues and resources for health care for people. And I know, as quiet as it's kept, there's a direct connection between economic status and access to health care. But I'm very, very pleased and happy to know that there are vehicles in our community and entities and organizations that are addressing these problems and want to encourage, the entire community, to find out more information about, what resources are out there, because we don't want to see anybody suffer, and we don't want to see anybody, in a bad way when they don't have to be. Was that all of the facilities, or did you miss one?
I think that was it for now.
Yeah.
We have another project we're working on with the Curtis Raines Senior Family
Oh,
Foundation.
talk about that.
Bryant Raines, who's currently the pastor at New
I know
Pilgrim,
Brian.
and his brother Curtis Jr.
I know Curtis.
have been working with us and with Navicent and other community partners, but they are going to be converting the old Bell Arbor nursing home
Oh,
into, yes, right there at Napier and Log Cabin.
Wow.
They want to put a health center site
Right.
in that location, and then bring other community services that would
Right.
make it easier for people in Bellevue and West Macon in
Wow.
general to access
Wow.
what they need.
Wow. How's that coming?
Well, we've been talking about it for a while, but the building was donated to them, and they have just completed that legal transfer.
Right.
So now we're going to get into the weeds of figuring out how we make this happen.
Well, I think that's a phenomenal project. I knew Brian's dad, Reverend Curtis Sr., very well, and I knew that was a wish and a dream of his.
Well, yes.
So I'm glad to see the possibility of that maybe becoming to reality. Well, how does one get in touch with First Choice Primary?
Well,
In case I'm sure there are going to be some people who are interested.
Well, there are multiple ways to do it. We have our main office number is 787-4266. We work really hard on our call center, but some days we struggle to answer all those calls. But we do have a website, which is exactly what you would think, www.firstchoiceprimarycare.org.
Okay.
On the website, you can find even the patient forms, all the, if you want to be a new patient, you can even get to our patient portal, which is an electronic portal, and put all your information in, and it comes electronically through our
Wow.
electronic medical record system.
Wow. So a person can access the services online,
Yes.
initially anyway.
Yes.
Yeah. This is a call to action.
A call to action.
I'm your host, Alex Haversham, having interviewed Ms. Catherine McLeod of First Choice Primary Care, imparting very significant and important information about health care for the uninsured, the underinsured, and other categories of folk. So it won't hurt to go to firstchoiceprimarycare.org if you want to learn more about it, or you can call
787-4266.
We want to thank you so much for coming and imparting this information.
my
This is
pleasure.
a call to action.
A call to action.
I'm your host, Alex Haversham. Have a great day.
Thank you.